Nathan Hill here, host of Success Stories. Joining me today is Meaden Yowes from Terrace Health Boise. We're talking about parents and spouses performing PCS caregiving during the pandemic and what this has meant for the industry and for the care of patients, their loved ones that they're caring for. Meaden, welcome.
Thank you.
Tell us about Terrace Health.
Terrace Health is a company that provides home care services, private duty nursing, home health services, and hospice services.
Okay.
We do all care in the community. So we're trying to keep patients in their homes and taken care of and out of facilities.
Okay. And about how many patients do you serve? How many families do you serve throughout the Southern Idaho?
Well, for what we're talking about today, on the home care side, it varies, but we typically have, between 100 and 150 patients.
Okay. All right.
Pediatric patients, right now, I have 25 or 30 pediatric cases, so total.
So you have 25 to 30 pediatric PCS cases, but then you have an additional 100 or so that are in the adult population.
Yeah.
All right. And what was the caregiving climate like before the pandemic, as far as being able to staff your families with qualified caregivers and keep them staffed? What was that like?
It was still a challenge at times, but it was not nearly as difficult as it became during the pandemic. It's gotten more and more difficult as time goes on. Inflation is not helping. We're competing with fast food restaurants and entry-level positions for pay. So it's really difficult to find qualified caregivers who want to work and take care of people for the same amount of money they could make at Subway.
Now,
it's difficult.
Wait a second. So what you're saying is that the caregiving, so because we know, I mean, in this particular field, what this entails is, you're, as a caregiver, you're doing everything. You're talking about you're toileting and changing diapers, you're bathing, you're taking care of soiled bedding, you're
all
feeding.
ADLs.
Yes, preparing
assistance with medications at times, all kinds of personal cares,
hygiene,
housework.
Housework. It's hard work.
Helping with doctor's appointments and keeping things straight.
Right. So it's hard work, and you have to you have to go through what kind of training do you have to go through to be a PCS caregiver?
Well, there's mandated training. It's approved by Medicaid and the Department of Health and Welfare. So there's several hours of videos and testing that each caregiver has to complete. They have to be, because it's Medicaid funded, a lot of times the PCS services, you have to just comply with whatever Medicaid puts in place. So we have to have background checks, driving record checks, the mandatory online training, the tests, TB tests, and then there's orientation as well for each company that provides these services as well.
And then you have annual compliance that has to be done. This caregiver has to go through annual compliance.
Correct.
So what you're having to do is, where you're at is you're paying them, or you're able to pay them, maybe even not quite as much as what you can go down and start at McDonald's at, and expect them to go through all of that training and do all this annual compliance and do all this hard work. That's what you're saying.
That's right. Yeah, that's right.
All right.
So it's not for the faint of heart.
Yeah. because you can go down to
people who truly want to help, you know.
right, because you can go down to McDonald's and you don't have all of that same caregiver training. You don't have the annual compliance. And you don't have to think about, this person's needs. And I mean, it's a lot of work.
Right.
Okay.
Yeah, it's physically and emotionally demanding.
Right. Very much so. Okay. And so you can go to McDonald's and get paid more than what you start at this job for. And this job, there's not really a whole lot of opportunity for raise advancement because the wages are set through Medicaid.
That's correct. So we have reimbursement rates for each type of service code from Medicaid. And those reimbursement rates are always about 5 to 10 years behind the times. So
Right.
as we wait for reimbursement rate increases, we're consistently losing employees to other jobs that are entry-level, easy positions. And our hands are tied because that's where our funding comes from. So if we essentially pay our caregivers more than that, we also offer full benefits to our caregivers because we do try to take care of them. They have PTO, a 401k with matching, health and dental and vision and all that. But once we pay that out and then pay the caregiver, we don't make any money. So right now we already don't make any money and we're still paying less than McDonald's.
Right. Isn't that something? Okay. So then with this scenario, okay, do the parents and spouses who have enrolled in this program, okay, or these waivers? So what has happened in brief is that when the pandemic came along, all government agencies were tasked with what can we do to make healthcare easier for those who are, those who are compromised, and everyone really. And so one of the things that was done is that CMS said, hey, parents and spouses of special needs loved ones can perform PCS care. This is forbidden by federal law, but we're going to allow it during the pandemic so long as the pandemic exists. Okay.
Right.
So the parents and spouses who are doing this now, who are taking care of their special needs loved ones, do they have to go through that same training process?
They do have to go through that same training process.
Okay.
Everybody essentially has to complete the exact same training tasks, even though it's their child and they're obviously very well versed in taking care of them.
Okay.
Or their spouse.
So they go through the background checks. They got to pass the background checks. They got to go through all the PCS caregiver training. They have to go through orientation. They have to do all their annual compliance.
Yeah.
Do they have to clock their shifts in the electronic verification visit app?
They do. So they have to clock it out using the app that we have all of our caregivers use.
Okay. And that's federally
mandated. They have to chart everything the same. There really aren't any exceptions.
So no exceptions. So they have to do all this. So basically they're as qualified as any other caregiver from a training aspect. Okay. As far as the company is concerned, what have you seen the families who are participating in this? What have you seen as far as the quality of care of the patient?
The quality of care and the consistency in care is wonderful. Parents love their kids and spouses love their significant others. So the care that's provided is done with love. And it's something that, it's unmatched by any other caregiver, really. Right now, out of my 30 pediatric cases, I have 19 parents working as paid caregivers. So that's how few cases are staffed by outside caregivers right now. I have 11 cases that we actually have staff for. So that's a staggering number.
And if those parents were not doing that care, would you have staff to replace them?
We would not. Our hands are tied.
Okay. And so the parents are providing wonderful care. The care, would you say that, so you would say the care is more consistent because there's no turnover?
There's no turnover. There's no calling in or calling out of shifts,
Okay.
They're always there to provide for their children or their significant others. So,
Okay. And what have you noticed any change in the say the tension or the stress of the home?
I think it's really relieved a lot of stress because in the absence of a paid caregiver from the outside that we normally would want to supply, there would create some financial stress because the parents are then dedicated to taking the time away from work to care for the children because nobody else is there to care for them. So in having some reimbursement for their time and some token of appreciation that they're there sacrificing all of their time and their ability to go to work, they're taking care of these kids. So it does show in their happiness and the stress on the family and relationships, I think.
Any feedback from these parents as far as what it's doing for them in saving dollars for the welfare system?
Yeah, I mean, I think that I talk pretty thoroughly with all the families about, what this does in a way of kind of keeping them afloat, keeping them out of the system, as far as needing assistance from, welfare or food stamps or whatever. So it really is just kind of a vicious cycle. So if we take these parents off of these cases and are no longer allowed to pay them for them, that makes their income decrease significantly. So when that happens, then they need more assistance from the government because they're still unable to go to work physically because they have to be home to care for their medically fragile children. So their hands are tied as well. So there's an alternative.
What kind of feedback have you heard from parents and spouses about this program?
Well, the first of all, they was permanent and they don't see why they haven't always been able to do this. It really is perplexing because it alleviates a lot of stress from everybody, all around. I mean, it's as far as Medicaid or health and welfare paying the paid caregivers, which is the spouse or the parent in this program, it's the same as paying any other caregiver, right? Except it's actually more consistent and the care is usually better. So it's something that it's just kind of a conundrum why we don't have a permanent program in place that can provide this service.
I have been telling Medicaid for 12 years. You should be paying parents to do this. This is ridiculous. Their concern is maybe, that we'll maybe cheat the system or that we'll abuse our children. With all of the parents and spouses that you have doing this, have you seen any trend that leads to fraud or abuse?
No.
Anyway,
I would say, the parents, the hardest thing is they're already at home working all the time. So sometimes it's just hard to remember to clock in and out because they're always doing the thing. They're taking care of their kids 24/7.
Oh, yes.
They're always on the clock. So it's kind of hard to switch their brain into the mode of, oh, I need to clock in for work,
Yep.
But they're absolutely, they do a great job with their kids and they take good care of them. And we haven't had any issues with any fraud or anything like that.
If you could say one thing to CMS, Centers for Medicaid and Medicare Services and Health and Human Services about this, what would you say?
Well, I would say that the program, they either need to come up with a program or make this one permanent, this temporary one permanent, to allow significant others, spouses and parents to be paid caregivers for their medically fragile loved ones. And that they need to obviously increase the pay to something that is comparable to, like a CNA in a hospital or something like that. It's just too low to expect to get any quality caregivers right now, especially from the outside.
Right.
where it's laughable, you know.
Yes.
It's really tied all of our hands, and it's creating an issue with so much stress and drain on families to take care of their loved ones and sacrifice their sleep and health and their work and everything. So
Right.
it's something that absolutely needs to happen. Something has to change.
And if it doesn't change, and before, in other words, if there's a lapse, say
Mhm.
if it doesn't change, the pandemic ends, at least the declared public health emergency ends, and and this stops, what is going to happen to all of these families?
It's going to create a huge financial and emotional strain on these families, you know. And when you have that, you have a lot of failed marriages, stress on relationships. The kids won't get as good of care. They're going to rely on people who aren't as reliable or can't take as good of care of them. You know, that's something that it scares me because, like I said, I have 19 parents right now caring for their kids on my caseload, and I'm just one company, you know,
Right.
many. So that's I don't even know what would happen if they took this out from under us. You know, these parents would then have to either get on the welfare system or go back to work and leave their child without care.
Right.
So that's a real tough one.
And so going back on the welfare system means taxing the other welfare programs,
Right.
saving money,
Yeah,
because
which doesn't make any sense.
doesn't make any sense because you'd be paying a caregiver anyway.
Yeah.
Why not pay the parents and save precious welfare dollars in other welfare programs that the parents no
Right.
longer need? Right.
Right.
Makes total sense.
It's robbing Peter to pay Paul. Right.
Right. And I think it's important to highlight here that these families, we families who are in this, there's really no normalcy. In other words, our kiddos, they're 24/7 care, they're day and night. Okay. And so you are up in the night, you know, it's not like you can just sit up late and work from home because your kiddos are 24/7 care. All right.
Yeah.
Is what they are.
And I think that's what the legislatures and the people sitting in higher offices don't understand is that you can't just get a babysitter, you know, kid who has a trach.
Nope.
And for a kid with a severe seizure disorder or other medical issues, you know, you can't just go down the street and hire a 14-year-old to come babysit. Have your nieces and nephews babysit, or your sister, or, you know, it's just, there are so few people that are qualified to care for these kids.
Right.
It just is not, it's not an option, you know.
Right. Important to note that creating a new program often takes several years.
Oh yeah.
So that throws everybody in a lurch. Okay. If we could do this, if we could pull together during the pandemic and do this and say, hey, let's let parents and spouses do this so that we can protect this vulnerable population, so that we can make sure that they're getting the care they need. If we could do that during the pandemic and it's a success, and we could come up with that just like that, okay? Because they came up with it just like that.
All they had to do is say it's okay now.
That's right. So what we need is an interim rule just like that.
Yep.
Okay.
Yeah, that would be best.
So CMS, HHS, if you're watching, please make this interim rule. Meaden, thank you very much for your time.
You're welcome,
a pleasure.
Nathan.
And certainly I would like to hear from your families, and please pass my info along to them and theirs to me. If you're watching this and you have a story to tell, please direct message me and we'll get you on here. So until next time, stay tuned. Thanks, Meaden.
You're welcome.
Bye-bye.